growing weary of running from room to room, practicing one-tooth insurance-driven dentistry? Then stay tuned for the latest episode of The Lionhearted, where Dr. Stephen Rasner will hand you the blueprint for what many call the gold standard of general practice dentistry.
Hi everyone, Dr. Steve Rasner here, and welcome back to The Lionhearted Dentist. Last week, I started part one of a two-part podcast for you where I thought I was laser clear on the cornerstones, on the principles that you need to achieve, to achieve success levels that I really believe most of our colleagues never dream of. They never even get to the point to think that this is possible. And when I got into the podcast, I got so into it that I only got through one of my 6 points. So I want to continue those for you today. And let me go back and just say this, because I didn't say this last week, and I wanted to. And by the way, I talk exactly about these particular principles in my live lectures, if sometimes my lectures are just on how to extract teeth and how to graft, implant-related subjects, but also there are many that I do that are on how to put it all together. And that's obviously what the Lionhearted principles are all about. But I wanted to tell you one major thing that I did not say last week. I didn't say this. Tony Robbins said it. I think Tony Robbins is a little overblown, but he does once in a while say things that I completely agree with. And he said the major deterrent on the growth of any business, not just dental businesses, is the owner. By the owner's own fears, limits, and stories he tells himself or themselves is why they aren't where they want to be. So, in a nutshell, those of you stuck in an envelope of horizontal non-growth, you've been going sideways for the last 3 years, or maybe worse. Look, this stuff does take energy. You can't achieve high success if you don't have energy. I think you can achieve high success without investing a lot of money. I mean, there's some basics I think you need that are what I consider lion-hearted, basic physical principles. You can't have a disheveled, unclean office. You know, that does cost some money. You've also heard me say it's not necessary. There's science and data on it that those opulent, incredible offices that exist out there, and I remember Dental Economics used to run a feature each year called the Office of the Year. Many of you listening remember this. And it would be this ridiculously beautiful office. Just mind-boggling. Waterfalls in the waiting room. I don't know. Fountains. Beautiful marble everywhere. And a lot of those offices went bankrupt. There was actually a study on it. That doesn't mean that every office that's beautiful goes bankrupt. I get it. It's not about having the most overdone office on the planet, but it is about having a clean office. It is about having a Walt Disney clean office. And if you can afford it, a warm, spa-looking appearance certainly doesn't help. It's kind of what I have. Other than that, if you follow the Lionhearted Dentist podcast, I never asked you to buy a $135,000 laser, that you can't make it without that. I never said that you had to buy a CEREC machine to restore your own restorations. Not at all. I never even spoke about digital scanning. So really, the investment is the investment of time, energy, and it is tiring to continue to keep up. But the reward is so huge. You know, and it took me a very long time to reach what some of you would call the summit. I mean, I had high numbers way before I was successful. That's an important thing to say. I had high production and case acceptance way before I actually was successful. That doesn't mean you're successful. If you make $2 million a year and you spend 2.5, you're not getting anywhere, right? So that's a subject for another talk. But let's get to this before I go through my time. But do remember that. Some of you are sitting there somewhere in the world and you're thinking you're just not going to be able to do this. And it's just not true. To become a dentist is not an easy thing. There's no way you could have achieved, passed your boards in whatever country you're in, and not have the ability to maximize your potential. That's just not true. I don't care what you're thinking, it's not true. You haven't tried hard enough. And any obstacle that may be in your way, I'm here to tell you that you can overcome it. I mean any obstacle. So that's how I feel about that. So let's get back to those points that I was talking about. And I left last week by talking to you about the right clinical skill set. And I really didn't even finish that. And I don't want to just focus on all the details for each point, because there are already many podcasts on what I think the right clinical skill set is. And just to be brief, it's the number one thing I think you should get if you want to broaden your skills, if you want to make your life easier, is a oral sedation permit. I should give a course on it. I don't even give a course exactly on that. When we give our clinical courses, everybody in the course is orally sedated. And I know many listening will say, oh, IV is even better. No, it's not. IV is not always better. There are some patients that do require IV sedation for successful outcomes. But oral sedation uncomplicates a lot of the things needed for IV sedation. There's a much broader scope of patients that will say yes to IV sedation. And I'm going to tell you, at the lack of a better explanation or way of describing this, it will make you a folk hero in your community. I mean, I am telling you that without a doubt, it's the number one thing that I've offered in my I've done it for 25 of my 40 years, that changed everything to this day. And it's just remarkable. You can market it. And for a lot of reasons, even the lion-hearted dentist audience isn't all going to run out and get a permit because they're scared, I guess. I mean, the fact that I come on this podcast time and time again and I tell you, I've never had one incident that was a complication related to the oral sedation protocol that I give you. Not one. I never even had a patient fall down. I never had to call 911 because something went wrong while we were monitoring their vital signs. Never. And I've joked with you that I've called 911 for other reasons. I did. Palpitations of their heart. They weren't on sedation. Just a number of things. Diabetic episode. Blood sugar was too low. That I have had called, but not for a sedation complication. So that's their number one skill set. And to me, I've been over it ad nauseum, as I've said before. You know, to me, the quickest way to long-term success is an oral sedation permit, learning how to take teeth out, not really wisdom teeth either. I have reasons for that. But really knowing how to take them out. Knowing how to manage the patient in the arena while they're orally sedated. Grafting. I mean, grafting is much more complicated than taking the tooth out. Like knowing what to use when, what bone combination to put in, what membranes to use, what socket seal on the top to apply. It's different if it's the aesthetic zone versus posterior teeth. So again, I've said it many, many times on different podcasts that to me, it's an oral sedation permit. Learning how to take teeth out atraumatically, meaning you're leaving 5 walls of bone. Knowing how to graft, that's way more complicated, getting a tooth out. Knowing what to use when to socket seal, what to put on the top of the socket. And then if you're going to know all that, it just makes sense for you to know how to some level of surgical implant dentistry. In addition to your general dental skills, I think that's an amazing road, unless you don't like surgery. The other factors I want to get to that I haven't mentioned yet is a team that brings their A game every day. They can't bring it once in a while. What do I mean by that? Do you ever go on vacation? The office is shut down for 5 days or more, and you come back from the day after, and you can feel it. They're still on vacation. Or whatever the reasons. You'll never reach the summit if it's just you that's a superstar. And that's a hard thing that I'm getting you to think about right now. Because some of you don't have that team. Some of you, that's the very reason it's holding you back, particularly if it's a person that's your new patient coordinator that's not 5 stars, particularly if it's an employee who sets up the finances around the case that you just recommended. If they're not top of the line, bring their A game every single day. If they're the kind of employee that calls out a lot, that takes their Aunt Carol to the airport on a given day, needs to call out for that, that makes doctor appointments in the middle of your schedule. No, I'm sorry. I mean, that's the wrong person. I don't know how to tell you. It's just what it is. Anyway, we'll get back to that. But that's what I mean. You know, a clinical team that's not just, have you taken the time? You know you can do this. You can have your dental assistant trained by, there's a couple places you can write to me if you want to know where, if you're in the United States, to make beautiful temporary crowns. I haven't made a temporary crown in 20 years. And I'm sure I would not be nearly as good as my dental assistants that are trained. So delegate what you can delegate. How could you possibly think I could achieve the numbers I'm talking about if I made my own provisionals? When the provisionals are being made, I'm in a different room doing something else. And I don't see that many patients today. They're long-term cases because they're sedated. But that doesn't mean I can't prep 5 through 12 in room 1 in an hour and a half, pretty relaxed, who's sedated, get up, go to a different room with my surgical assistant, have my restorative assistant in room 1 making indirect, out of the mouth, gorgeous temporaries that she has all the time in the world to do. I don't want you to get the picture that I'm jumping room to room to room. That's not success. But I am not stuck in a room doing temporary crowns. My dental assistant also can move teeth around in wax try-ins. Another skill they can learn from a lab. You know, we all have labs, right? Different labs we use, and most of us have a local lab that maybe does denture repairs, maybe does some of your dentures. They can learn there. You can pay your local lab to teach her how to do that. You know, or let me give another example. Repairs. We did this years ago. We had multiple assistants go to the lab and learn how to really do a lab quality repair. You know, not super glue the tooth back on or the break back together, but really repair it like a lab can do. And he taught her how to do that. He never charged me because as a courtesy to, you know, all the other business we give them. But it wouldn't have mattered. I would have gladly paid him anyway. But there's no way you're doing this. And you need to sit back and go back to your office and write everybody down that works for you. Do you have people that bring their A game every day? Or do you have people that do what I said? That doesn't always mean you have to terminate them if they're taking their Aunt Shirley to the airport and call out for that. That depends on how often that happens. And then you have to have a relationship-based practice. And that is not just a cute phrase or a warm and fuzzy phrase. That's real. A relationship-based practice means the people in your practice understand the importance of having connections to the people that are coming in. So I have a practice, like many of you, the cases can take 4 to 6 months or longer if it's implants. So these patients are coming in over and over to the practice for multiple visits over the 4, 6, or 8 month period, sometimes a year. And everybody knows their name because they know that I want them to know their name. And when I say that to you, it's not just their name, but it is a big deal, is it not? When Mrs. Smith comes in that you're on the 7th visit for, or her husband, and they know that you know them. And they know that everybody in the team understands their particular treatment needs. Can't put her back too far in the chair. Better be on time. Well, you better be on time anyway. It's the easiest way to be credible and be different from a lot of practices. It's not where I want to go right now, but how many of you have gone to whatever business it is, it doesn't matter. I got a 15-minute tops waiting list for me. I didn't know I was like that. I can't help it. When I'm waiting I went to Starbucks yesterday to do something nice for my team, to buy them some warmed blueberry muffins. It was Thursday, the last day of the week of working. It was a nice thought. I was in a good mood. I go to that Starbucks a lot, and it's usually very expeditious. 5 minutes tops. They got many, many workers. I don't know what happened, but I waited 15 minutes, and I didn't say anything, but inside I was not happy. If that happens again, I doubt I'll go back. There's no reason for you. If you are running late, I can give you 3 tips how to not run late. You have to write to me for that. So having a relationship-based practice is part of why I get these numbers. If I have a patient that feels I'm connected, do you ever have a patient say to you, "What do you think I should do, doctor?" You've heard them say that. That means you have a relationship with that patient. It does. And that was earned by you, by more than I can give you in a 30-minute podcast, by you being real, by you caring about the people that come to you. Look, it sounds fuzzy and maybe even fake, but it's not. I hope it doesn't sound that way, because it's not. Having a 5 stars, this is point number 4. The right clinical skill was number 1. A team that brings their A game every day. And you got to address that if they don't. I have to address it throughout the year. Let me give you a quick example. I've been in business 40 years. About 5 months ago, I had to reconvene a special meeting with my front desk team, which is 5 different people. They're scattered around my office, but there's 5 that are involved in front desk activities, confirming the next day's schedule, going through whatever insurance, and I don't take insurance, but that's another conversation. We still have to know their insurance. So that person, 2 front desk receptionists, and I told them, I said, I can't work like this anymore. Somehow we've descended back to, I can get here anytime I want, between 8:30 and 9, because we start at 9, because Doc, which is what they call me, will never say anything. I just said it like that. I said, it's just not good enough. Somehow it became a thing where as long as one of them was there by 8:30, I was okay with it. I told them they all had to be there 8:30 every day. Every day. I don't want to hear about it one more time. That's the end of the story. That's what I mean by, having people that bring their A game every day. You can't have your A game if you start your day 20 minutes late or not prepared for that day. I know this may sound trite to you, but it's not. Starting your day on time, you put a patient at 9 o'clock. They have to get numbed. You're not starting on them anyway till 9:20. So you got to factor a lot of things in to make you be on time. I was getting to 5-star new patient experience and case presentations. I'm going to give you the Cliff Notes version of these last 3 that I'm giving you. There's 4. So I'm sorry. Right clinical skill set, team that brings their A game, relationship-based practice. We've covered those at this point. Now I'm at 5-star new patient experience and a case presentation that's 5-star. Well, that speaks for itself. And I have many podcasts on this subject. It simply means this. I've said it in many different ways to you. To me, it's like a show, not a fake show. That's how important the new patient experience is. And it starts with the first phone call to your office. I hear my Michelle on the phone with a new patient, 40 years of doing this, and it's flawless. You know why it's flawless? She loves her job. I know many of you have a Michelle, and that's who should be your new patient coordinator. I just told you I have 5 people at the front desk. There could be even more I can't think of right now. They can take the initial call if she's busy, which often happens, and she says they get all the data, the basic chief complaint, but they always say, we have a new patient coordinator that's really good at it to help you feel comfortable and help navigate your way from this phone call into our office and seamlessly. And she's going to get back to you within a half an hour. Does that work for you? And I don't remember anybody ever saying no. But I have one person that does it so much better than the rest that I'm not going to take the chance on somebody else doing it at this point. I would change it if I had to, if she retired. But why would she retire? She's only worked 41 years. Kidding. And of course, in my case presentation, I've gone over that. Like, it starts with them not waiting. 5 minutes is too long in the reception room. The first phone call, a flawless going back to the operatory, re-interviewed by Michelle, the one that interviewed her over the phone. And go back to my case presentations podcast and you'll see the reasons why. But if that's 4-star, 3-star, no. You're going to lose a lot of potential case acceptance. It's just a fact. The next one is having a giant practice nucleus. Again, there's podcast on this. And really what that means is not everybody's a candidate in your office or mine for moving forward with the work that you recommend. And it's important for you to go back to the podcast, if you can find them, and write to me. If not, I'd gladly give you, I have a lot of this in writing. And it's exceptionally important that you know that what your lines in this sand are. In other words, I just said not everybody's ready to move forward with the treatment you recommend. Well, what are you okay with them not doing? Example, they need a crown on the lower right first molar, but they have a sea of inflammation. And they say, well, can't I just get the crown right now? And I'll, absolutely not in my office. Now, I rarely, if ever, have gotten questions like that. I might have. Or can't we do a G scale? You know, something that costs less. Now, with soft tissue rehabilitation, it is what it is. You can't compromise. You can with a tooth. You could put a Hail Mary core buildup on a tooth that needs a crown. You could do that. But you can't compromise with soft tissue. It's the key to everything. The best dentist in the world, many of them in Philadelphia, world famous, Amsterdam, Weissgold, names that you look them up in dentistry, legendary guys. You know why a lot of their work worked? Because they, although they were phenomenal restorative dentists, put a high premium on soft tissue care. Man, I wish we could do this in person one day because you could feel my passion. If you're timid to recommend 3-month or 4-month recalls when the patients are inflamed around all their teeth, including your restorations, then you're not doing yourself, your legacy, and of course the patient, a service. If you're too timid to recommend that because you know that the insurance is going to pay for that, you got to build the culture of your practice. You got to stand for something. That's why that's a line in the sand that I'm not going to cross. So I call it lines in the sand. Like, what are you okay not treating? Now, there's some things, many things I'm okay with not treating. Said earlier in a podcast last week that, I can do large restorations. I've crowned and opened a vertical on patients by crowning numbers 2 through 11 or 12 and held the new open vertical with composite on the upper left premolar and molars until the patient could afford full coverage. I've done that. I don't think that's a no-no. I'm just going to get to this because I'm into the 27th minute. So I've told you there's 7. And today I don't want to repeat them again, but the ones I'm getting to today is the 5-star service, giant practice nucleus. The 2 I'm not going to be able to get to is having great branding, which means marketing. I used to market in the first 5-6 years of my practice. Now it's in the 80s, and I would advertise new fall hours or new spring hours. That was it. And then I got into the fear thing of treating fearful patients before I even knew how to sedate. And if you're marketing convenient hours or prices, then you're probably listening to the wrong podcast. Because you're marketing so you want to attract. I used to put emergencies accepted, same day appointments. I did that. It was a different culture to this practice that I have now. I don't market to that. I market to sedation patients, to fear patients, to first-class, world-class treatment of the patient and their mouth. And the last cornerstone was embracing getting paid up front, which has a multitude of patient benefits beyond what you can recollect, that you can comprehend, and me doing a disservice to trying to rush it off. So I tried to do these podcasts in 2. I'm going to extend it to a 3rd podcast, these cornerstone principles. Again, so I have pretty much covered the right clinical set that you need, the right clinical skill set, a team that brings their A game. I think I covered that pretty well. A relationship-based practice. I'm going to expand a little bit next week on what a 5-star new patient experience really means. The giant practice nucleus I definitely want to expand upon. Great branding, indeed. What should you be spending your money on when it comes to marketing? It's important. Are you even marketing? My patients come to me not because I'm marketing affordable dentures or open till 11 o'clock at night. By the way, I did do that early in my career. And then the cornerstone of embracing patients committing to work by getting paid up front. That's the benefit of it all, and I'll go into why. I hope this is helping you guys. I know it's a little deviation. It's also a little bit of a recapitulation of many principles I've given you, but I think you need that with the Lionhearted because it and anything you do that you do at a high level. Thanks for tuning in. Please reach out to me at drrasner@aol.com. See you next week on the Lionhearted.